me just share a story with you, and I can do this since I am a physician, and I can talk about my colleagues across the street over here. Once you get that MD degree, once you graduate and walk across that stage, let me tell you, there's no doubt in anyone's mind that's walked across that stage that they become an expert in everything. All of a sudden, that MD degree confers a great ability on you to become a great marketer. You understand accounting, you understand finance, you understand design and construction, and you have no qualms about sharing some of that expertise. Now, A.L. mentioned I've been a gastroenterologist and a physician here for almost 30 years. I am so glad my chief financial officer or chief development officer has never once told me how to do a colonoscopy. So I told you, I've been here for almost 30 years. Temple is my hometown. I grew up here. My wife and I graduated from Temple High School in 1972. And I will tell you, at that time, when we were going off to college, we said we're never coming back. We've been back 28 and a half years and have loved every single second of that. When I did complete my medical studies, there was no lack of job opportunities. We could have gone anywhere. We looked in California, we looked in Las Vegas, we were in Utah, we almost stayed there. We looked at jobs in Arizona, New Mexico, Tennessee, Virginia. We ended up in Temple. And there was good reason for that. Yes, we had family here in Central Texas. That was a big part of it as well. But Temple and Central Texas is a great place to live. It's a great place to work. It's a great place to raise a family. We couldn't find that combination anywhere else. We came back, and like I said, we've been here now for 28 and a half years. Central Texas has a great history, and the people that live here are proud of their heritage. We've always been willing to work with each other and our neighbors to support those that are in need. The United Way of Central Texas has been a great neighbor as well. They've been around since 1951. And they have always been around to help mobilize resources to promote healthy lives. Now, we talk about health and healthcare a lot, but a healthy life is more than just an absence of illness. The World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. What the World Health Organization is really talking about are the social determinants of health. And there are 5 key social determinants of health: economic stability, education, social and community context, health and health care, neighborhood and environmental resources. So what are we really talking about? It's food, it's shelter, safety, transportation, jobs, training, language and literacy, it's culture, it's green spaces, it's a walkable city, it's bike trails, it's parks. It's limiting physical abilities, physical barriers, so that individuals with physical disabilities are able to be mobile within the city. It's community-based resources, it's social support. Doesn't this sound like the United Way? This is all what the United Way is about. And as Ali mentioned, I mean, Harvey and all of that, what a tremendous impact the United Way has had on all of those individuals. We always talk about the economic impact of these weather-related events. I wonder how much of that economic impact is related to healthcare, lost housing, lost medications, inability to access healthcare, lack of transportation. It's a huge sum. As a physician who has worked here at Baylor Scott & White at the Temple Community Clinic, I've taken care of patients who don't have insurance, whose financial means are limited, and who often lack just basic necessities. I can tell you that their medical conditions generally are far more advanced when I see them. They have greater disabilities and their outcomes are generally much poorer than those that have some financial resources. These individuals often, through no fault of their own, become a burden on society. It is here that the United Way can really make a difference. I've seen firsthand the effects of the United Way in providing education, financial stability, basic needs, and of course health. You know, it's amazing to me that this country, the United States of America, spends 18% of its gross domestic product on health care. No other country in the world spends anywhere near that amount of money. France, Germany, the Scandinavian countries, maybe 11, 12%. But the vast majority of countries spend less than 10% on health care. Now you would think with that type of expenditure, one of the richest countries in the world, that we would have great health outcomes. We don't. We're at best middle of the road, maybe in the top third. Other countries do better as far as life expectancy, infant mortality, vaccination rates, you name it. We're spending a lot of money on health care. Don't get me wrong, we have the greatest health care in this country, it's just that it's not equitable. It's not across the entire country. It doesn't cover all 320 million people that live here and those that have come here to visit. I do have some news for you. That 18% is not going downward. It's estimated that in 2025, the U.S. will spend 20% of its gross domestic product on health care. I don't know how to figure that out, but it's about a 5 or 6% increase in the cost of health care every year between now and 2025. We've got to do something to bend that curve. It's not just a lack of health care and health insurance that is causing this rise. I mean, you would think a lot of that is the case, and it is a big factor, but it's also just the overall economy and also the aging population. We as baby boomers are getting older and are requiring more and more health care. If we're going to really bend this healthcare cost curve and prevent us from getting to 20% of the GDP spent on healthcare, we need to do everything we can to keep people healthy and well. This is the concept of population health, and I'm sure many of you have heard about population health. It is truly keeping the sick from getting sicker, keeping the healthy from getting sick. All healthcare, or as healthcare providers and as physicians, we've always been good at taking care of sick people. We haven't been good at keeping people healthy and well. This paradigm has shifted. We're going to need to do everything we can to keep people out of the hospital, to keep their disease states from progressing. And it really is true. There are two key factors for population health: controlling medical costs and utilization. Right now, this country's healthcare system works on a fee-for-service basis. I do something, I get paid for it. Did I do it for the right reason? Did I do it for the best interest of the patient? It's not always clear. We really do need to go to value-based purchasing, where we may get paid a certain amount to cover a life, and then we decide how best to utilize that money to take care of that patient. This is going to be a fundamental shift. We also have to focus on the second big item, which is delaying or avoiding disease progression across the population. And this is going to take a community effort. I'll guarantee you, if you pick up today's paper or you turn on the news station, you will hear something about health care. You will hear efforts about repealing Obamacare. And you know, I don't know where that is, and honestly, to me, it doesn't matter. I don't care if we call it Obamacare. I don't care if we call it Romney Care or Trump Care or I don't care. It doesn't matter. Our problems are the same. We are going to have to focus on this. The challenges are not going to go away with the government deciding on how to run healthcare. We can begin working together through the United Way. We all need to be communicating the message of health. It doesn't matter who you are or what kind of work you do or what company you work for, we all have something to offer to help the health of our communities. Great example that Al mentioned is Bridges to Wellness. Again, people that get discharged from the hospital or have specific needs and don't have the financial means to pay for prescriptions or equipment. The Bridges program covers those needs until a long-term solution can be identified. I want all of you to be engaged in the United Way. I will encourage you to be engaged because I see the effects of the United Way every single day that I work at Baylor Scott & White or at the community clinic. All of us working together must come up with solutions. Solutions like the Bridges program with outcomes that can be measured. We have shown with Bridges that we can reduce the number of emergency room visits. We can reduce the number of readmissions to the hospital. What a great step in starting to cut down the costs of health care. So let me close with just a quick quote from Lyndon Johnson. Lyndon once said, "There are no problems we cannot achieve together and very few that we can solve by ourselves." It's going to take us as a community working together to begin solving these problems. We can't wait for the government to fix health care. It's not going to happen. We have to continue to work together. So let's do this starting today with this United Way kickoff. Let's make this one of the most successful campaigns that the United Way of Central Texas has ever had. Thank you all for your time. I really appreciate it.